Your story matters, don't let it fade. When everything changed.
Hey, this is Wendy with One Stories, and today I'm joined with an old friend of mine, Jenna Green. Welcome, Jenna. I'm excited because we reconnected. We've been friends on Facebook for a while since we worked together. We were in our 20s, and we won't say how long ago that was. But, um, since reconnecting, Jenna shared some of her stories, so I'm excited for her to share her story with you. So, without any further ado, Jenna, I'll give you the floor to share your story.
Thank you, Wendy. So I'm a respiratory therapist and I absolutely love what I do. I'm very much invested in my job. But a handful of years ago, I was pushing myself just to the limits. And of course, at the time, I didn't know it. I was trying to do everything, be everything. And it was more so at work. You know, my family was very supportive. I had two girls at home. My husband was, yep, go out there, do your thing. I support you. So I was trying to create and build a respiratory department that I could be proud of, get it to be strong, confident, and be able to provide that skill to the hospital staff that I worked at. And I was pretty proud because I was able to bring on more staff, provide services that I believed was a great contribution to our community as well. And I was the kind of manager that was, I'm not going to stress out my staff, so I'll do it all. So I never denied PTO or anything like that. If they had to leave to do anything personal, I was completely fine. You do what you got to do. I'll cover it. Don't you even worry about it. And I was proud that I could do that because I was completely willing to go out there and work the floor and tangle with the doctors and the nurses. And it kept my skill up. I loved it. So I was working well over 100 hours in a paid period. I was taking calls. So I was working shifts, 10 to 12-hour shifts, and then taking calls. So I was getting paged out in the middle of the night, having to go into the hospital, and then, multiple times during the night sometimes, and then also having to come back to work at 7 o'clock, 6:30, 7 o'clock in the morning, and then work another 10 to 12 hours. And I didn't complain because I could do it. I'm going to do it. If I ask my staff to do this, then I'm going to be able to do this. So I kept doing it and then had some holes in the staff. So I just keep plugging away. And I was starting to feel bogged down and kind of getting that brain fog that we kind of all do. And I thought it was just because, I'm probably dehydrated, probably should eat something because it's been, like so many hours. And I worked with amazing staff at the hospital, amazing ICU nurses. And we kind of always joked that, we're going to work ourselves to death, because we never want to have to put the stress on our coworkers. That's just how we work. So there was a day I just wasn't feeling very well and I kind of felt foggy. I thought my sugar was low. I was walking in a back hallway talking to one of the nurses and she was walking towards me. I was walking towards her. And I was walking on a boat because I was like swinging, but that's what it visually looked like to me. Like, why is she walking so funny? And then I collapsed and she caught me. She didn't know what was going on or anything like that. She caught me literally. I wasn't responding. I wasn't waking up. She did a hard sternal rub on me. I wasn't like coming through. So luckily were in a hospital back by the ICU. She called a code blue. And like great staff that I was working with, they just all swarmed in. I came to when I was in the ER, had no clue what was going on. And they just chucked it up to probably stress, just dehydration. You should eat something, that type of thing. I'm like, okay, yep, check, got it, good. Told me to, stay home for a few days, whatever. So I ended up coming back to work. And I didn't realize until probably a little later that when I had collapsed, I kind of convulsed, but you do that when you pass out. So that wasn't abnormal. And then I was having more weird episodes and where I would kind of fog. I would be sitting there talking to somebody and I would check out. I would still be there, my eyes would be open, but it was like someone put a pause button on me. But I didn't know that. And then I would come through and I would be like, wait, what just happened? And they're like, wait, you weren't even taught, you weren't even there, John. And I was like, yeah, I'm right here. But I was like slow in my speech and stuff. And this happened probably over a few months. And then it was, I still continuing to work. I can still do it because I'm a strong woman. I can do this. I'm smart. I can figure this out. And then there was an episode, a couple months later, I had an episode where I ended up losing consciousness and completely convulsed. Full on spastic movement. It lasted for a while. I did not wake up like fully for like 3 hours. Had no clue what was going on. I came through, I couldn't get my words out. I was really groggy. Doctors really couldn't tell us anything. It was just kind of in and out like that for probably a full year. Just no answers, but those episodes were still occurring. My husband was starting to take videos of me because doctors weren't really like, I'm not going to say they didn't believe me or believe him, but they were like, that's a good story. But it wasn't witnessed. And then I came into the hospital and my husband said I had an episode. So he brought me into the hospital. Ended up having a seizure in front of them, enough to worry them that they had to give me some medication to get me to stop seizing. And it was weird. The medication just made me feel wonky. I couldn't even, it took like a good half a day for me to figure out what happened, and my muscles would be so sore from just tightening up so bad. And that happened on and off up to 4 years. I was on 4 doses, 4 different seizure medications at max doses. So I was like a walking zombie. I was there. I was participating in life, but I don't recall any of it. My oldest daughter, when this started, was starting high school, so going into her 9th grade year. I don't remember any of it. I was a zombie. I had so much medication on me and they told me that when I would have seizures, it kind of creates like Swiss cheese brain. It just puts pockets of these holes in your memory. So I don't recall a lot of things. I don't remember. We have pictures of like when she got her driver's license. I don't remember that. I have a picture of it. And I just kept saying, I can manage this. I can do this. Just let me do my thing. I'm a little bit stubborn. So I would get auras before I'd have these seizures. So I would go out of the room. I would try to get myself out of the room so nobody would see it. So they didn't know that they were happening because I just didn't want to put the burden. But I also I felt personally like that I was weak when that happened, which isn't a really good idea when you have a seizure. So a couple times I would go into the bedroom or go into the bathroom and I ended up collapsing because I would have a seizure. And so then my girls would hear a thud or my husband would hear a thud. One time I was getting discharged from the hospital because they couldn't figure out what was going on. And then I had a seizure in the middle of my kitchen. My husband was with me the whole time and he's like, girls, I'm running to Quick Trip. It's literally less than a mile away and I'll be right back. Just, keep an eye on your mom. So my 2 girls are babysitting me. I was emptying the dishwasher and the next thing I know, I have 4 paramedics over me and a police officer with my oldest daughter and a police officer with my youngest daughter in our house. They're trying to get IVs started on me. I have no clue what's going on. I kind of faded out. My oldest daughter ended up having to call 911. So that kind of, she had to grow up. Both my girls were forced to grow up pretty fast. They thought I had epilepsy. So I ended up having to go to the epilepsy center, get tested, which was supposed to be a couple-day visit. I ended up being there for a week. It was inconclusive, but the specialists were pretty confident that I had epilepsy. So I had to just grin and bear it. Fine. I accept it, but I don't. In my head, I'm screaming, I don't have epilepsy. But I still kept doing what I was doing, trying to work, trying to be supportive at work. Kept trying to do it all. And finally, since we weren't getting anywhere and I was maxed out on doses and still having seizures, my husband was kind of like, do you need to go see another specialist? Maybe we need to see a different neurologist. I'm like, that's fine. So we did, and my husband was my advocate at the time because I was frustrated and I was mad at the medical world, oddly, since I worked in it. I thought I knew best, and so I'm like, if they can't figure it out, I'm just going to do my own thing. And he had to have a sit down, come to Jesus type of moment with me. And we talked to the neurologist, and he's like, you know what? Let's just take her off everything, and start over and see what's working, because she's maxed out on 4 doses. She's not stopping having the seizures. What else can we do here? And he's like, that's fair. Let's do it. So I was at home. My husband basically had to babysit me. He had to cut down to part-time, partly because he didn't trust me, because I would not always make the best judgment. And I'm sure he did that because he loved me. But it was like 3 weeks after all of the medication was out of my system. I laughed, and he looked at me and he teared up, and he was like, oh my God, there you are. There you are. I haven't seen you. I'm like, what do you mean? I've always been here. He's like, you haven't laughed. You haven't had that smile for 4 years. And I felt good. I felt like myself. And we were like, okay, well, let's not upset the apple cart. Let's just keep doing what we're doing. If you have a seizure, we'll address it, but you're doing great. If you have any auras, let me know. Months went by, didn't have a seizure. I also learned to put up boundaries, as my oldest daughter told me that they're guardrails. Sometimes we need the guardrails to bump us back. So I had to. The neurologist came back and was like, it's not really uncommon for women in their 40s to start having seizures, because they're always go, go, go. They're mom. They're trying to be the chaos director of everything and go, 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 go. And then if you don't take care of yourself, your body has this amazing system and it will just shut down. And how your body shuts down is different for everybody. Your body decided to say, you know what, you're not listening to any of the warning signs. So I would shut down and my body would have a seizure. And that allowed me to sleep for hours afterwards, because that's what you do. Your body's recovering after a seizure. And I'm like, I don't have time for this, and so it took a long time for me to realize that I always had the power to figure out. I did have control of this, but I wasn't listening to myself. I was listening to myself knowing that it wasn't epilepsy. but I wasn't going any further with it. So I had to really learn to be my own advocate and knowing what I could do. Still be great at your job, give 100% at your job, but you don't have to sacrifice yourself. And my seizures were brought on strictly because of sleep deprivation and stress. I was working all those hours and I was taking call, so I wasn't having the sleep. I wasn't not allowing my body to recoup. And then I would have seizures and I would go back to it. I was still working and I'm making my husband drive because I couldn't drive because when you have a seizure, you can't drive. So we had to come to the realization that I need to listen. And my husband, I love him. He is my rock, and he kind of threw it back in my face. He's like, you tell your patients you have to be your own advocate. You tell your patients that you need to take care of yourself. Like, why won't you take that advice? I had lost 4 years of thinking that I knew better, and I don't remember any of the high school years. My daughters, my youngest one, when she went through high school, I was more aware. I was off the seizure medications, and so she knew how important it was for me to be actively participating in her high school years because I don't remember any of my oldest ones. And as a high school girl, she could have easily said, "Ma, please," but she also had to live through that. So she was good. She let me participate in all aspects of her life. I was the loudest cheerleader for her when she played tennis. Um, I went to all the banquets and stuff, and I can't say I did that with my oldest daughter because I was either so tired or I was sitting there but not really there. So when I talk to coworkers that are invested and want to be a mover and shaker, it's great. And I always warn them that you have to take care of yourself. I don't want you to end up in a situation where you lost something that you can never get back. And that was really unfair because my husband was basically taking care of a zombie, and he would never tell you that. But so my girls very much know that you can be successful. You can be the smartest person. You can be the most compassionate, all in, but you got to take care of yourself. And nothing is more important than family. But it just took me 4 years to figure that out. And it's something that eats at me. My daughters are good. They're like, Mom, we didn't know that you weren't there. We don't ever feel like you were absent. You were there. You sat with us. You talked to us. You let us talk to you about stories. You would laugh. And yeah, I wasn't the normal mom, but you laughed. But I don't remember any of that. We have pictures. Thankfully, we do have pictures, but I don't remember it. They remember my goofy times when I was on the medication, and medication really messed me up because if I had a seizure, they would give me the medication and I would hallucinate horribly. So I don't want to be on medication. I'm not on any medication, which is awesome. I have to get my sleep. So, because of some of the seizures, you know, your brain gets wired a little differently. So sometimes my brain doesn't shut down. So I have to take medication to help me sleep at night. Because otherwise I put my risk at having a seizure and I just don't want to go through that again. So I'm compliant with that. I can say I'm compliant, but you read and you watch stories about how to be your own advocate, and it just sucks with that you have to go through it sometimes to really get it. And sometimes you can be right there with somebody going through it and it still doesn't hit you until it hits you. And that's just not fair. But
Yeah. I was going to ask you this too is I think you probably felt like you were advocating for yourself through that because like I'm going to get through it, right? We're told we got to be strong, do all the things, right? So I'm so grateful that you had your husband and your especially your husband, I mean, to
yeah,
say something's not right.
and it's nice because we can have the conversations, like you're not listening. And I would tell him, I am listening. And he's like, no, you're not. And he's like, and that's not fair because the doctor only can help you with what you're willing to tell him and in your honesty about it. When you say that you're feeling great and you haven't had any seizures, and then I have to tell him, oh no, you did, or you're pushing yourself. I I look like I'm trying to manage you, and I don't want to be the person, the man that's managing you. You are a strong woman, so he just had to get me back into my boundary area,
Right?
and it's nice that we can look back. Um, it still sucks. I don't know how he did it. You know, he put in the time and never once complained, never once.
Wow.
And we had to rely on friends and family for a lot of things that I didn't know. So it just, I don't like appearing or being weak, and asking for help is a weakness.
Yeah.
It's just it's a stupid, hard lesson to have to learn. How many times do you have to trip over yourself? But it only took me 4 years. Oh gosh.
Right?
And I also thought at the same time, it's a it's just a blip. 4 hours out of your entire life, or 4 years, it's just a blip. I know people who have been through much more. I have no ground to complain about. I have nothing to be sorry about, nothing to whimper about. But it had a huge impact, and we all have our own little blips.
And that's the thing is, you can't even compare stories because it's so different from each person, whether it's hugely traumatic or, whether you want to call it a blip, it's still your life. You can't compare one to the other.
It could be just a conversation that had a huge impact on you. Sometimes you don't have to have the big, shining, blinking warning sign to hit you in the face. But it was really hard for me to admit that, but also tell people, you
Right.
know, it happened. So I want you to take care of yourself, and all of us, it's not just healthcare workers and it's not just women, but I think women are maybe a little bit more susceptible to that because
I think so.
there's, but yeah,
That's awesome. Wow.
big
Thank you. What's that?
a journey.
Yeah, it is quite the journey. And, you know, you were being an advocate for all of your employees, the people that were on your team and stuff. And then here you are like filling in all the gaps and doing all the things so you don't inconvenience somebody else, or make someone else. And I think that's part of mostly women. I mean, men are that way too, but mostly women, especially if you grew up a certain way or who knows what the cause of that is, but then you sacrifice your own health in the process.
I had great parents with work ethic, so I put the work in.
Yeah. Wow. What a hard way to learn a lesson. I mean, really, but like you said, there's I believe anyways, there's a reason for everything, even though, you had to go through this hard thing and it affected your family and all that. I mean, they were there for you. But now on the other side of it, you can share that message and like, look, this is the things that can happen. Maybe not exactly in the same way, but paying attention, look at those, orange cones that are showing up in your life trying to, you
Just
know,
take a moment to step back and see the bigger picture. And is it really important to do all these things right now. And if you're having to juggle, maybe take a bigger picture and see what are the important things. You know, you're working all those hours and trying to do that for the department was great, and I'm very proud of myself that I did that. But since I've left that position, you know, it's not like I left a legacy or anything like that. I was replaced, just like any other employee. But my daughters would have had a huge, bigger impact if I was gone. So I very much want to be present, especially since I'm going to be a grandma. So
Yeah. And now that you have some of those systems put in place, you know, you have those
yeah,
guardrails on, right? It can kind of keep you in check a little more so that you can be a very present grandma and do the things that you want to do with your family.
absolutely. And it is, hindsight's beautiful, you know. I just wish I had clearer vision during the time and during the moment, but hindsight's beautiful.
Yeah. Awesome. Well, thank you so much for sharing your story. I appreciate it so much.
Yes, thanks, Wendy.
Your story matters.